Good morning everyone, Chris from the Headache and Pain Management Centre here for your Monday morning, and today talking about the biggest waste of time treatment when it comes to chronic pain. It's used relatively frequently still, but all of the evidence suggests that basically this is a waste of time when it comes to the long-term relief of chronic pain, especially low back pain. So if you are joining us, type in below, say hello, and any questions that you've got coming through, please type in and I can answer for you. So to get to the ending straight away, the biggest waste of time treatment when it comes to chronic pain, in my opinion, is electrotherapy. Okay, so what electrotherapy is the use of ultrasound, the use of TENS machine. G'day Valerie, good to see you there. Ultrasound, TENS machine, interferential. These sorts of machines have been used in physio clinics for the last 20-25 years. In conjunction often with heat packs and things like that, have been shown when it comes to the treatment of chronic pain to be a complete waste of time. And I can tell you from basically the last 5 to 6 years of having the clinic here that I haven't used an electrotherapy machine in the whole time I've opened the clinic, and we're getting awesome results. So basically there was to give you a bit of a story about how this came to pass, that electrotherapy was a big thing back in the 80s and 90s and even the early 2000s in private practice physio. There was a lot of thought about how electrotherapy actually works to change tissue, whether it be ultrasound, whether it be interferential or TENS machines. And there used to be a thought that basically this could be a really good adjunct for long-term pain relief. But all of the evidence now, they've done a stack of research into this kind of stuff. And we now know that for the short term, it can give you some relief. You know, it can actually change the pain signal so you get a little bit of relief short term. So I'm not saying that it's a complete waste of time for people who already got TENS machines that use them infrequently just to give a bit of temporary relief for pain. But if you're wanting something for long term, resolution of symptoms, resolution of pain, then you need to do something more active. So we talk more in terms now of active treatments versus passive treatments. And it's those active treatments which are much more effective. So exercise, doing things to reduce your stress, perhaps even mindfulness meditation, getting stronger, getting movement, getting exercise, getting educated about how your pain works. Whereas what we classify as passive treatments would include electrotherapy. So getting someone to put an ultrasound on you in a heat pack, or putting some electrotherapy on you for 20 minutes and lying there flat isn't going to do you much good. It's actually doing more strength work and educating more about your condition, which is going to make the biggest difference. Now look, when you're getting electrotherapy, when you are getting ultrasound and interferential, yes, as you know, people will actually recognise is that at times it can give you a really good bit of pain relief, often up to a few hours, sometimes a day or two, but the pain will inevitably always come back. And a lot of the time, the pain relief that you're getting from that if you like, that intervention. G'day Lockie, good to see you there, buddy. That intervention is more to do with your brain expecting that you're going to get some outcome or get some relief rather than actually anything that the machine is doing. This is specifically like ultrasound. They've shown this to be the case. And when it comes to TENS machines, yes, it does tap into the signals, the nerve signals that do pass up, and it cuts down those signals coming up there. But for long-term chronic pain relief, we need to know that it's the active treatments like strength work and education which will get more of an outcome for you. So if you are getting those passive treatments, and we see this a lot where people are coming in that have had chronic pain for 10, 20 years and things like that, and they've been to their chiro, their physio, their other healthcare professional, perhaps the osteopath, every week for the last God knows how long, and they're still just staying much the same. And there is actually more that can be done. If you're staying much the same, you're getting the same treatment over and over again, and you're not getting any relief from the symptoms, and perhaps you need to actually have a look and see what you can do differently. This is particularly true if you are just getting passive treatments, whether it be electrotherapy, heat packs, maybe just a little bit of mobilising of the neck, followed by some ultrasound and heat, rather than having anything more integrative like an exercise program, pain education, or strength work, strengthening the specific muscles and joints to get the relief that you actually need, because they're more things that are more active treatments that can get a much better result for you. It's good to see everybody there. It's obviously a very popular topic this morning. Good to see you there, Belinda, as well. And yeah, basically that's pretty much the message I wanted to get through, that you need to make sure that you're getting some active treatments, treatments where you can control it yourself, that you can get your muscles bigger, get your joints moving more, get yourself more confident, more stable, more strong in your own mindset and will set about how to tackle this problem, which is chronic pain, chronic headaches, chronic migraines, because yeah, it's a real minefield out there for patients. And basically what the whole purpose of what I do these videos for is to give you the best information about what the best things to do are based on the current evidence and also based on the things that we've seen here in the clinic. It's been really good joining you once again, and if there's any questions underneath, please type in below. Happy to start a conversation either on or offline with you, and we can talk to you again soon later in the week. Thanks for joining me, and bye for now.